Imagine a world where people wait until they get severely ill to visit the emergency room because they have no insurance. Imagine a world where income and health insurance determines your level of health. Does this world seem familiar to you? Unfortunately, it's the world we live in today. However, this is all about to change with the passage of the Affordable Care Act. The Affordable Care Act will affect everyone in one way or the other. You all should know what type of impact this law will have on your lives as U.S. residents. As they're experiencing difficulty accessing healthcare, I am for a change in the U.S. healthcare system. As a student and aspiring physician, I have researched about the Affordable Care Act and what it brings. The Affordable Care Act is a great change to the United States healthcare system. Today I will talk to you about why the Affordable Care Act was passed, how it protects consumers, and how it is good for the economy. First, I want to talk to you about why the Affordable Care Act was passed. The Affordable Care Act was passed to ensure that the middle-class, hardworking families get the security that they deserve, and it protects everyone from the worst insurance company abuses. Insurance companies were notorious for denying coverage to people who frequently visit the hospital because they felt that they would make a profit on it. Many individuals were denied further coverage during crucial times of battling an illness because they had no insurance. This resulted in many uninsured people left to find treatment for their health without any help whatsoever. So what were the many uninsured people to do? In 2012, distinguished journalist Meredith Lockman wrote in the Nature journal that the Affordable Care Act will relieve the burden of charity care on many hospitals. Many uninsured people were going to the emergency room as a last resort to seek treatment. Unfortunately, due to desperate times and high costs, many of those people lied and submitted fake information to be admitted to the hospital. Ultimately, taxpayers were left to pick up the tab. So now that we know a little bit about why the Affordable Care Act was passed, I want to talk about how it protects its consumers. The Affordable Care Act will improve the quality of healthcare while holding insurance companies accountable. Obamacare forces insurers to cover everyone, including those who are already sick. This means that insurance companies are now prohibited from denying coverage to those who have a history of illness or who have fallen ill. In 2012, physician Dr. Jane Orton was quoted in an article by Fox News that her main concern with the Affordable Care Act was that she believed it focused mainly on cutting costs rather than improving the patient's experience at the doctor's office. However, in 2011, the U.S. Department of Health and Human Services released a news article that stated that the Affordable Care Act will reward many accountable care organizations that lower healthcare costs while meeting performance standards on care quality and putting patients first. This ultimately means that the providers will be happier, which will ultimately result in happier patients. Before the Affordable Care Act, the providers would be paid regardless of the level of care that they offer. Now, they're actually, by being rewarded, they can constantly offer a higher level of care and receive gratification along with compensation. So now that I talked to you a little bit about how the Affordable Care Act will improve, protect customers, I want to talk about how it is good for the economy. The Affordable Care Act will ultimately lower the deficit in the United States. In 2012, Paul Starr, professor of sociology and public affairs at Princeton University, wrote in the New Republic that the Affordable Care Act will ultimately cause Democrats to face up to explicit tax increases to uphold the act itself. This would mean that in the future, taxpayers would have to pay more in taxes to maintain the Affordable Care Act. However, in 2012, distinguished journalist Ezra Klein wrote in the Washington Post that the Affordable Care Act will reduce the budget deficit. Oh, I'm sorry. In 2012, distinguished journalist Ezra Klein wrote in the Washington Post that the Congressional Budget Office and the JCT have estimated that the Affordable Care Act will, on net, reduce the budget deficit of the United States from over the 2012 to 2021 periods. This would mean that despite the increase in taxes, this would mean that our economy would be improving because there's more money in circulation and to be used in various other areas. So now that I talked to you a little about how the Affordable Care Act is going to reduce the budget deficit, perhaps it's time to wrap things up. The Affordable Care Act is a change in the United States healthcare system in the right direction. Today I have talked to you about why the Affordable Care Act was passed, how it protects consumers, and how it is good for the economy. The Act itself has been through numerous trials and much scrutiny. Despite it all, it has been passed and remained valid. The change has already occurred. And I believe it is up to us to embrace it, make the best of it, and to learn to improve.